Am I audible now? Yes, am I audible now, everyone? Sorry for the delay. As I mentioned, there was power cut, so was waiting for that to get resolved, and thankfully it's done. And now I hope you can hear me and you can see me as well. Am I audible now? Please a quick nod in the live chat, thumbs up. Yes, that's great. Okay, so here we are with the topic of neuroanatomy, top 10 mnemonics, basically. PDF. I actually wanted to share the PDF, but I'm sorry I could not share before the session. After the session, I'll do it. After the session, I'll do it. The lymphoma wala PDF is also pending. Okay, I'll do it. Okay, without any further delay, let's start with the today's session and few quick updates before that. Number one, we are meeting today at 8 p.m. Again, especially for the FMGE students on the strategy, like in these 2 months, what you should be focusing on and how you can crack the FMGE exam. If you have any queries related, you can get it on board there as well. It's a YouTube live session on the YouTube channel called Desi Doctor Abroad, and I've shared the link on the Telegram group already. Okay? And second update is that the next class in the ongoing all 19 subjects mnemonics batch, which is going on the Unacademy platform, it's gonna be tomorrow at 12 p.m. and the subject is orthopedics. Okay, so we are gonna do orthopedics tomorrow. Okay, so let's start with this, and the first question here it is. Heschel's gyrus is located where? This is one of the recently asked questions. Where is Heschel's gyrus located? Is it primary auditory cortex, visual cortex, parietal association area, or medial frontal lobe? This is one of the recent year questions, the PYQs. Let's see who gets it right the first. Okay. So I can see some answers coming in. Who gets it right the first? Very good. Anjali. Then we have Lakshmi. The correct answer is primary auditory cortex. Okay, it is primary auditory cortex. You can remember this as Heschel's gyrus. Heschel's HE is HE. Remember, it is the hearing. Okay, it is for hearing. So remember that Heschel's is basically related to hearing. That means it is the primary auditory cortex. Okay, it is the primary auditory cortex. All right. So that was the first trick here. And how do you identify the Heschel's gyrus basically? So look at this location. I'll come to this image after we solve one more question here which I want you to solve, and then I will go to that image of Heschel's gyrus. Actually, this is the third question in our series of top 10 mnemonics and neuroanatomy. Wernicke's area. Where is the Wernicke's area located? So Brodmann areas actually are very important for your exam. Wernicke's area is located in, let's see who gets it right. Very good. Wernicke's area, absolutely right. It is superior temporal. Okay, it is superior temporal. How can you remember this? Wernicke's area is superior temporal. You can remember it by west. Okay, so remember east, west, basically west. That is Wernicke's area is superior temporal. Okay, so remember the trick to remember is Wernicke's is superior temporal. Okay, Wernicke's is superior temporal. That is west. Okay, so now I will go back to that Heschel's gyrus wala question. Now, if you see in this image, like this is the temporal lobe, right? This is the temporal lobe here. This is the superior temporal gyrus, and this is where you are seeing the Wernicke's area. Okay, that is Wernicke's area, and adjacent to that in the superior temporal region itself, you see this temporal gyrus of Heschel's. That is Heschel's gyrus, area 41. So you have 41, 42 basically, which is primary auditory cortex, and you have Wernicke's area, which is area 22. We will look at the numbers also. Okay, we will look at the numbers also. So remember that this is where you have the Heschel's gyrus adjacent to the Wernicke's, that is area 41. Okay, that is area 41. Okay. Next question on the Brodmann area. Frontal eye field is what Brodmann area? Frontal eye field is Brodmann area 4, 8, 41, 42, 1, 7, 17. Frontal eye field is Brodmann area. Great. I can see many of you getting this right. Dr. Atul, Mona. So the answer to this is, it is Brodmann area 8. Okay. So you can remember this as frontal eye field. Okay. The eye field. So this is the eye field. Draw the eyes. And then you have the spectacles basically, right? Around the eyes, you have the spectacles. So remember that is like number 8. Okay, the eye field is number 8. So remember, like the spectacles, that is your number 8. That is frontal eye field. Okay, that is frontal eye field. We have seen a similar mnemonic somewhere. Spectacles wala is number 8. Does anybody remember? Where else have we seen this? Ki spectacles is like number 8. किसके spectacles famous है? Mahatma Gandhi, right? Mahatma Gandhi. So myasthenia gravis, basically the HLA association. Very good, Agnimita. It is HLA-B8. Okay, it is HLA-B8. So here also remember MG, that is myasthenia gravis. MG is Mahatma Gandhi. Unka chashma is like the number 8. It is HLA-B8. Okay, this HLA-B8. Now look at this image. Okay, look at this image. Which is showing you the Brodmann areas. So the primary sensory cortex, okay, the primary sensory cortex and the primary motor cortex. So first is the sensation, like let's say putting your finger into hot water and we feel the sensation. So the primary sensory is basically 1, 2, 3. Okay, first comes the sensory. Then you have the motor. Remember motor, the movements, basically we move with the 4 limbs. Okay, the movements of the 4 limbs. So the primary motor is basically area 4. Okay, so remember primary motor is area 4. Sensory is 1, 2, 3. So if this is the central sulcus, post-central is primary, pre-central is motor. Primary motor ke aage is premotor cortex, which is 6, and then you have the frontal eye field, which is 8. So basically you have the even numbers 4, 6, 8, right? Then we saw here basically the temporal wale mein, the superior temporal gyrus that we had. There is the Wernicke's area, right? Wernicke's area. So remember that Wernicke's area, that is the superior temporal gyrus. Temporal gyrus wale ka number hai TT, that is 2. Wernicke's is 22. Okay, Wernicke's is 22. And here you have basically this Broca's. Can someone tell me where is the Broca's area? Broca's area. Wernicke's is superior temporal. Broca's is? हाँ रेनू, जितना भी अब तक पढ़ाया है सब कुछ पढ़ना पड़ेगा. There's a lot that we have discussed. Broca's area is superior frontal, inferior frontal, superior temporal, inferior temporal, parietal नहीं. This is basically the area 44, 45 where you have the Broca's. So remember B-I-F, right? Broca's is basically, remember the alphabetically, I-F, these come close together to B. So it is inferior frontal. Okay, it is inferior frontal. And frontal wala jo hai Broca's, isme sab jo numbers hai, if F wale hain. That is 44, 45. Okay, it is 4, 4, 44, 4, 5, 45. Temporal में TT वाला है 2, 2, 22. ठीक है? तो west is Wernicke's superior temporal 2, 2. And you have Broca's inferior frontal FF 44, FF 45. So remember it is 44 and 45. Okay, 44 and 45. All right, so that is for broadcast frontal wala. And what is the Brodmann's area for the primary visual cortex? Can someone tell me the Broca's area for the primary visual cortex? Visual matlab dekhna, matlab see. Okay, see is SE, basically it is 17 wala. Okay, it is 17. Okay, so remember that this one here, the occipital lobe, the primary visual cortex, that is 17. Okay, so remember seeing is visual, seeing is 17. Okay, seeing is visual and seeing is 17. All right. So these are the important Brodmann areas that you should know. So let's revise. Number 4 is, what is number 4? 4 is motor, right? The primary motor, we move with all the 4 limbs. 41, 42 is the primary auditory cortex. So हमने Heschel's वाला देखा 41. 17 is seeing, so that is basically the visual cortex. Okay, that is visual cortex. So that was about this question. Let's go to the next one. Question number 4. Quadrigeminal cistern contains which of the following? What is the content of quadrigeminal cistern? What is the content of quadrigeminal cistern? I lost the live chat. Give me a minute. Very good. Absolutely right. Bindu, Akhila, correct. It is the vein of Galen. Okay, remember it is the vein of Galen which is the quadrigeminal cistern ka content. Now, where is this quadrigeminal cistern located? So if this is the midbrain, right, the Mickey Mouse shape wala midbrain, the piche wala part, that is the colliculi. We have 4 colliculi, 2 superior, 2 inferior, so 4. So basically that is what is called as quadrigeminal plate. Okay, that is called as quadrigeminal plate. So uske piche ka jo cistern hota hai, smiley shape, that is the quadrigeminal cistern. And what is the content of this quadrigeminal cistern is vein of Galen. So basically the 2 internal cerebral veins, they unite to form the vein of Galen, and it is there in the quadrigeminal cistern. Look at this image. Okay, the images are very important in anatomy. So this is the midbrain, tegmentum, tectum, that is the quadrigeminal plate, the colliculi, and this is the quadrigeminal cistern. Behind the colliculi, quadrigeminal plate, this is the quadrigeminal cistern. And you can see this content here, this is basically the vein of Galen. And if I ask you the next question, what does vein of Galen drain into? What does vein of Galen drain into? Vein of Galen, you can see this vein of Galen here, it is draining into this sinus which is straight sinus. Okay, it is straight sinus. What forms the vein of Galen? The 2 internal cerebral veins. Okay, the 2 internal cerebral veins, they form the vein of Galen. So basically you can see it is inferior to the corpus callosum, the splenium of the corpus callosum, and that is the content of the quadrigeminal cistern. Okay, that's the content of the quadrigeminal cistern. All right. Important question that you get here is basically the vein of Galen malformation. Let me show you this image. So this is the MRI, where you can see this dilated vessel here, a lot of prominent flow voids in this MRI, and it is draining into the straight sinus. So basically this is vein of Galen malformation, vein of Galen aneurysmal malformation, which is basically an AV fistula. In the axial section, you can see here in the midline and draining into the straight sinus. Okay, there are a lot of prominent flow voids because of the AV fistula. Can someone tell me what is the classical clinical history with vein of Galen malformation? What is the classical clinical history with vein of Galen malformation? Always remember this: a newborn with hydrocephalus and heart failure. Okay, a newborn with hydrocephalus and heart failure. Very good, house MD. So hydrocephalus, problem in the brain, heart failure because of the AV fistula. That's the classical history of vein of Galen, and it has been asked previously. Look at this image here. What are we seeing in this image here? This is basically the midbrain, right? And this is where you have the vein of Galen. Okay, the green one is the vein of Galen, and you can see the two internal cerebral veins going around the midbrain, they unite to form the vein of Galen. Okay, they unite to form the vein of Galen. All right. So it is located behind the quadrigeminal plate in the quadrigeminal cistern, vein of Galen. Look at here as well. So basically you have the two internal cerebral veins forming the vein of Galen, into which the basilar vein also drains, and it's draining into the straight sinus. Okay, it's draining into the straight sinus. All right. So that was about this question. Let's go to the next one. Important, very, very important. Identify the labeled nerve. This is the labeled nerve here. What do you think is this nerve here? Is it optic, oculomotor, trigeminal, or it is trochlear? Okay, so many of you say it is trochlear. Who's got it right? Anjali, House, MD, correct. It is oculomotor nerve. Why it is oculomotor nerve? Look at the anatomy here. Okay, look at this anatomy. So first identify this here. What is this here? This is the basilar artery. Okay, this is the basilar artery. We are looking at the ventral aspect of the brain. It is not on the dorsal aspect. Trochlear is on the dorsal aspect. Why this is oculomotor? This is not trochlear. Because look at this basilar artery, the terminal branch, posterior cerebral artery. And look at this. What is this artery below the PCA arising from the basilar? This is superior cerebellar artery. Superior part of basilar say right? Superior cerebellar artery. The nerve which basically courses in between these two arteries, that is the oculomotor nerve. Okay, that is the oculomotor nerve in between these two. That's an important relation that you should remember. This is the optic nerve forming the optic chiasma. Okay, this is the optic nerve. So uske piche this is oculomotor. You are not seeing the trochlear here. Okay, trochlear yahan nahi hai. This is the trigeminal nerve, the thickest nerve coming from the pons. Okay, that is the trigeminal nerve there. All right. So remember, the relation basically helps you to identify that it is between this PCA and the superior cerebellar artery. You have the oculomotor nerve. Between the posterior cerebral artery and the superior cerebellar artery, we have the oculomotor nerve. Which vessel aneurysm can lead to third nerve palsy? Look at this one. This vessel coming from the internal carotid. This is the posterior communicating, joining the ICA with the PCA. Remember, posterior communicating is a branch of ICA. You can see it coming here. When it has an aneurysm, it compresses on the third nerve. Okay, PCOM aneurysm commonly causes third nerve palsy. So this is oculomotor nerve. Look at this image. This is oculomotor nerve. This is the optic nerve here forming the chiasma. And the thickest one here is the trigeminal nerve. Okay, that's the trigeminal nerve. All right. So important, between the PCA and the SCA, you have the oculomotor nerve which goes. Okay. Next one, identify the labeled vessel. What do you think is this labeled vessel here, this one? Is it basilar, is it pica, is it ICA, or is it SCA? That is superior cerebellar artery. Identify the labeled vessel, this one. No, it is not pica, guys. It is not pica. From where this vessel is coming, look at the image again. This is the vertebral artery. Okay, the two joining to form the basilar artery. In front of the pons, this is the pons. So this is where you have the basilar artery. So this artery is coming from the basilar. It's not coming from the vertebral. What are the branches coming from the basilar? What are the branches coming from the basilar? Write down basilar as basilar. Okay, so basically the PAS is what you should remember. So the posterior cerebral artery, the ICA, and the SCA. It is not pica. Okay, the A and the S, these cerebellar arteries, the ICA and the SCA, they come from basilar. Pica comes from vertebral artery, right? You can integrate it with Wallenberg syndrome. We read in Wallenberg syndrome, the lateral medullary syndrome, it's the blockage of pica or vertebral artery. That means pica is vertebral artery. Okay, so pica to definitely nahi hai because the artery which is labeled here is basilar. It is not the PCA, it is not the SCA because basically it comes at the end. Inferior part se aa raha hai basilar se, so it is AICA. Okay, so it is AICA. So remember, AICA, anterior inferior, basically comes from the inferior part of basilar artery. Labyrinthine artery is commonly a branch of AICA. Sometimes it can be basilar, but generally it is AICA which gives the labyrinthine artery. Okay, please remember basilar is basilar, the PCA, AICA and the SCA. From the vertebral artery, you are seeing this artery coming out medially, going to the spinal cord. This is anterior spinal artery, and this will be the pica, which will, which will come from the vertebral will be the pica. Okay. All right. So look at this labeling here. This is the basilar artery. This is the AICA. Okay, and these are the two vertebral artery. Okay. All right, next one, important question. A previously asked question, what is the cavity of mesencephalon? Is it lateral ventricle, third ventricle, aqueduct or the fourth ventricle? What is the cavity of the mesencephalon? Who has got it right the first? Dockhead, Akhila, right. Almost all of you have got this right. Remember, it is the aqueduct of Sylvius. You don't need to mug this up. If you remember the image, you will remember this. Mesencephalon is basically the midbrain, right? So when I draw the midbrain like this, like the Mickey Mouse, यहाँ पे जो होता है डॉट सर्कल जैसा स्ट्रक्चर, दैट इज द एक्वेडक्ट. ओके, सो द मिड ब्रेन हैज द एक्वेडक्ट. लुक एट दिस इमेज हियर. वी हैव सीन द sagittal image here. This is basically the midbrain ka anterior part and this is the posterior part, the colliculi, right? What is going through this midbrain? Okay, this is the aqueduct of Sylvius, which is going to the fourth ventricle, joining the third ventricle with the fourth ventricle. So you can see that through the midbrain, basically you have the aqueduct of Sylvius, right? You can see the vein of Galen going into the straight sinus. Look at this MRI image. MRI because the bone is black. Okay. T1 weighted MRI because white matter is white. This is the midbrain. Previously asked question in radiology. Mickey Mouse shape jaisa, ears jaisa hai. The structure labeled 1 here. Basically this is what is aqueduct. Okay. The rounded structure, that is the aqueduct. A potential radioanatomy question. Okay, so you can see that it's in the midbrain. So that is mesencephalon ka cavity is the third, the aqueduct of Sylvius, not the third ventricle. Okay. Can someone tell me what is the structure labeled 2? Can someone tell me what is the structure labeled 2 here in MRI? So you can see those two, the paired structures, basically they are located in front of the midbrain. This is basically mammillary body. Okay, this is mammillary body. Remember, we have MB. Mammillary body is located in front of MB. That is the midbrain. Okay. Pineal gland is not here. Okay, pineal gland is not located here. Where is the pineal gland? पीनियल ग्लैंड या मिड ब्रेन के पीछे और कॉर्पस कैलोजम के नीचे. पीनियल ग्लैंड यहाँ आएगा, मैमिलरी बॉडी यहाँ पे आएगी. ओके, एंटीरियर इन फ्रंट ऑफ द मिड ब्रेन. ओके, सो दैट इज मैमिलरी बॉडी. MB in front of MB. Okay, and what is this structure here? These are the optic nerves joining here. So basically this is optic chiasma and then it forms the optic tract. Okay, then it forms the optic tract. All right. Okay, let's go to the next question. All of the following pairs are correct for nuclei of hypothalamus except. All of the following are correct except which of the following? Okay, let me see who's getting it right the first. Anjali has got it right the first. I see few incorrect answers as well. The correct answer is this. So remember that in the nuclei of hypothalamus, the hunger and the satiety. So imagine like you are eating like this. Okay, so eating, hunger is coming from the lateral side. When your tummy is full, that means there's satiety. You don't want to eat more. So हम बहाना करेंगे नहीं खाने का, धीरे धीरे we'll eat like this. Imagine like it's coming from medially. Okay, so medial is basically satiety. It's not the hunger. Okay, so eating lateral, ventromedial like this is satiety coming from the medial. Okay, coming from the medial. Okay, so remember that lateral is what is hunger, the ventrolateral. Supraoptic, paraventricular. Okay, the hormones, remember V for O and O for V. What does that mean? Supraoptic nucleus, O for V, it secretes basically vasopressin. The paraventricular secretes basically oxytocin. Okay, oxytocin. So what do you want to remember is V is for O and O is for V. That is ventricular wala is oxytocin, optic wala is vasopressin, that is basically ADH, which is antidiuresis, which is water conservation. Okay, water conservation. Posterior nucleus is the shivering center. When do we shiver? When it's cold or when it's hot? When do we shiver? Of course, when it is cold. So remember that cold versus heat. Cold is posterior, heat AT is anterior. AT is anterior. Okay. So remember, write down heat as HEANT. So cold, O for O, it is posterior nucleus. Okay. Cold is posterior nucleus. Suprachiasmatic CH is CI wala, that is circadian rhythm. So chiasmatic CHI, basically it is circadian rhythm. Okay, circadian rhythm. So remember the incorrect is basically this one, because ventromedial is satiety. Okay, ventromedial is satiety. Alright. Going to the next question. Which of the following is not a component of the auditory pathway? Which of the following is not a component of the auditory pathway? So see how you will rule out the options. Now in the auditory pathway, all of us must have heard the mnemonic E. colima, or we also hear about SLIM. Okay, both these are the mnemonics basically for auditory pathway. So in that SLIM, basically one is superior, one is lateral, one is inferior, one is medial. So you have the four important components in the auditory pathway. One superior, one lateral, one inferior, one medial. So you will not have two lateral or two medial. So one inferior, one superior, you don't have two lateral. Okay, you don't have two lateral. So either it is lateral geniculate body or it is lateral lemniscus, which is not a component. क्योंकि lateral कोई एक ही हो सकता है इसमें से, ठीक है, दोनों नहीं हो सकता है. So automatically option A and option C are ruled out, because this is, you know that the answer is between these two. Now whether it's lateral geniculate body or lateral lemniscus, which is not a part. So when we talk about E. colima or the SLIM, okay, what is that basically? So E. colima, or it is basically, it is SLIM. Okay, remember it is SLIM. So OLIM or SLIM. So basically SO is the superior olivary nucleus, LL is the lateral lemniscus, I is the inferior colliculus, and M is the medial geniculate body. Okay, it is the medial geniculate body. Now, if you get confused whether it is the medial geniculate body or the medial lemniscus, which is the component. So remember that medial geniculate, okay, so basically M for music, okay, M for music, and G for Ghana, okay, G for Ghana, which is basically auditory. Music we hear, Gana we hear. So remember, it is medial geniculate, which is auditory pathway ka component, not the medial lemniscus. Okay, it's not the medial lemniscus. Medial lemniscus is basically your dorsal column wala. Okay? So lateral lemniscus है, lateral geniculate body नहीं है. Okay, it is a medial geniculate body. Lateral geniculate body, remember L for light. So it is the visual pathway ka component. Okay, it is the visual pathway ka component. Lateral geniculate, L for light, it is the visual pathway. Okay, so remember, it is superior olivary nucleus, lateral lemniscus, inferior colliculus, and the medial geniculate body. Look at this. What do we have here basically? Superior olivary, lateral lemniscus, inferior colliculus, and we have the medial geniculate body. Okay, MG, inferior colliculus, lateral lemniscus, and superior olivary nucleus. Okay, so this is about the auditory pathway. Next one, which of the following is false in Brown Sequard syndrome? What is false in Brown Sequard syndrome? Ipsilateral loss of vibration, ipsilateral loss of pain and temperature, ipsilateral loss of motor function or fine touch. Which is false? Neetu, I'll soon come up with a class on spinal cord with the tracks and everything. Okay, let me see. A lot of mixed bag answers here, but majority are right. False is ipsilateral loss of pain and temperature. So remember, the trick is in Brown Sequard, all are lost on the same side except on the opposite side. Remember, opposite is loss of P and T, that is pain and temperature. Okay, so remember, opposite is basically pain and temperature. It is pain and temperature which is lost on the opposite side. Rest of it is on the same side, because basically the spinothalamic tract carrying the pain and temperature crosses at spinal cord. So remember that in Brown Sequard syndrome, it is contralateral nociceptive pain and temperature. Rest all is ipsilateral. Okay, so loss of pain and temperature and light touch or crude touch is on contralateral side. Rest all, vibration, motor function, deep touch, it is on the ipsilateral side. Brown Sequard is basically the hemisection of the cord. Okay, it is the hemisection of the cord. So remember that opposite side is pain and temperature. Okay, pain and temperature, it is opposite side. Okay, opposite is pain and temperature. Okay. So yes, that was about the top 10 mnemonics in neuroanatomy, neuromedicine or neurophysiology. It's all very much integrated. I hope you have enjoyed this. Remember, all these points are important and have been asked previously. We are meeting again at 8 p.m, particularly the FMGE candidates for the FMGE strategy for the next 2 months. What is that foolproof strategy that you can use to clear your exam? I'll be talking about that. Okay, and all the Unacademy Plus subscribers, I'll see you tomorrow at 12 p.m. for Orthopedics K mnemonics. Okay, so yes, that was about the today's session, top 10 mnemonics neuroanatomy. Thank you so much for joining in, and goodbye, take care, keep studying, keep revising, and keep winning. Thank you.